important as your portion, Carol. So I want to thank you for joining the Introduction to OBUS presentation. We are working on transitioning our original OHBH system to the new OBUS system. And OBUS is the Ohio Behavioral Health Information System. It's a system, it's an upgrade from our department's OHBH, and it's client level episode of care information and an outcomes reporting system. So this is an introduction to that system. We're in the phase where we're really just helping folks to understand what the system is, getting them familiar with the terminology, getting them familiar with the system. And we will be working on an actual rollout plan in the future. So we don't have that date today, but we definitely be working on something in the future. I want to say that I am so grateful for Carol Karstens for her work and leadership on this system. She has been doing this work for quite a few years, and we are so proud that we have a product that we are able to advertise and able to discuss with everyone. And this product is going to help us with our outcomes. It also is going to help us with our requirements with our block grant. It's going to help us with the data that we need to make informed decisions. And so we are so proud to have Carol at the department, and we're proud to have her presenting this presentation today. If you have any questions, we'll leave time for the end. But again, we are working on an implementation plan and working on an actual date for this to roll out. It is not rolling out today, but we wanted to make sure that we socialize this concept with the field. So Carol, if you're ready.
I guess I'm ready. Welcome to Introduction to OBUS. Can I have the next slide? Oh, wait. Before we get started, there are some housekeeping things. If you look at your screen, you should have it toward the bottom of the PowerPoint presentation. You should see a bar. If you put your cursor up on the screen, you should see a bar, and it has in the middle of it, it has a hand, and then it's got a call out to show conversation. What I'm going to ask you to do is to keep your speakers or your microphones muted till the end of the presentation, and it's only going to be about 15 or 20 minutes of presentation. And then either raise your hand or use the call out button to click over to the where you can type in your questions. And then at the end of the presentation, I will we'll either call on you by clicking on your hand and having you speak, or we'll click on what you've written in the chat box. So I think that's the main thing I needed to do for housekeeping. Did I overlook anything, Beth or Rob? Okay. Okay, let's get started. Let's go to the next screen. So this is what we're going to go over. What is the OBUS system, and what is reported, who reports, and how does it work? That's just the introduction. So next screen. So it's a web-based reporting facility, and it collects treatment episode information. It's originally known as a treatment episode data set, or TEDS. It includes SAMHSA national outcome measures, we call them NOMs. And treatment episodes are defined by an admission record, a transfer record if you have that, or a discharge record for SUD admissions, or with an MH admission, which is kind of new to this system, is an upgrade, and we're including a more robust MH record, is an admission, an annual update, or a discharge record. With MH, oftentimes clients stay in the system for years at a time, so rather than wait for a discharge record, the system will ask you for an annual update for those long-term clients. MH TEDS is required by SAMHSA Substance Abuse and Prevention Treatment and by the Mental Health Block Grant.
This is why we have to do this.
Yes.
Yes.
What I have to hear is if we don't do this, we are going to lose $85 million.
Yes.
you there?
She must have run away.
I think Carol's talking, but it looks like she's muted herself.
I don't know how I did that. I don't know how I did that.
It's
Okay,
easy,
so
believe me.
yeah, so the TEDS file or these records, this has been a requirement of the substance abuse block grant for years. It's only been in the last couple of years that the mental health block grant has required these records. So it's kind of new. In fact, it's new to mental health to be asking for this and for asking for client level data that's a treatment episode record. So to move on, next screen. So the national outcome measures, this is an outcome system. When we have an admission, that's a time 1, and we have an update or a discharge, that's a time 2. So we look for change between time 1 and time 2, and that's the outcome. And the NOMs, they're shared, several of the NOMs are shared by both MH and SUD. So for example, employment status, educational status, living arrangement, and criminal justice involvement. Those 4 NOMs are shared by both MH and SUD, and they're measured through this system. This system also measures social connectedness for SUD clients. And so going to the NOMs helps Ohio outcomes be compared to other states. It is a national system. So next screen. There's other biopsychosocial information in this database or in this record system, like for example, smoking status or military status or referral source, pregnancy status, primary source of income, diagnoses, special populations. And that's where we collect information on non-conforming gender identity, also trauma history, deaf, hard of hearing, and we collect discharge reason, which is helpful information. Next screen. So who reports? Now this is Ohio Revised Code. So providers certified or licensed by Ohio MHAS to provide behavioral health services are required under ORC 5119.61 and OAC 5122-28-04 to report information in OBUS. So how you comply with those with ORC and OAC is by reporting information in OBUS. So and what the rule says is the department shall collect information about services delivered and persons served as required for reporting and evaluation relating to state and federal funds expended for such purposes. So although this is driven a lot by federal funding, it is the state information system around outcomes, and also gives us just client information. So for whom is information collected? Any client admitted to treatment for a mental health condition or substance use disorder whose services are paid in whole or in part with public dollars. That would be Medicaid or a grant with the Adams Board or Ohio MHAS. Now, if you have a grant with the local jail, or you have a grant with criminal justice or child welfare, though if you're paying for treatment through those grants or those dollars, those are not reported in the OBUS system. It has to be Medicaid, Adams funding for mental or behavioral health, and Ohio MHAS funding. Next screen. So how are data reported? OBUS users can enter records in the application 2 ways. There's manually through an online data entry template. And we generally say that if you have an annual caseload of 500 or less, it might be wise to go with the manual option, but it does require a dedicated data entry staff, at least one, to do this. Or you can do it semi-automatically through a batch upload feature, and we recommend that providers with annual caseloads of 500 or more to consider this option. And with the batch upload, data are extracted from the agency's information system or EHR and is formatted in a flat file and uploaded manually. That's why we call it semi-automatic, because your records don't go automatically from the flat file into our system. You have to upload the files. And you do need to work with your IT staff or EHR vendor to implement batch reporting. With the manual data entry template, you can pretty much just sit with some training, sit down and enter the data. Next screen. So this is what the data entry template looks like. If you have used the OHBH, you'll see that it's a much more open data entry template. So here's the item, primary income source, and then you select and you have a drop down menu and you choose pre-selected items. So those values are set. You have to enter those values. You don't enter, there's no enter your own values. Next screen. This is the batch upload feature. So you say you have a flat file with records laid out in it. You would use the upload button to take the file up into the system, and then you would get data processing information on what you uploaded. Now this system too, it's one feature, and I pointed out it near the top of the screen. You must obtain a signed release of information to be able to create an admission record. And then you click a signed release that this information has been obtained. That's also true with the manual data entry template, where we are requiring, and you'll need to think about your data flow when you do intake with a client. Typically, I would say it should be done when you're going over the HIPAA releases and consents to treat. You want to be sure that your intake information informs them that the data is shared with the state, and they give you permission to do that. If they refuse permission, you don't report the record. That's simple as that. Okay, next screen. So it does take planning to report records. First of all, we need you to identify an organizational staff to act as OBUS provider administrator. That person will then authorize staff access for every other staff in the agency who want to access the system. So that person applies to have access. Ohio MHAS staff grant them authorization, and then they turn around and grant staff at the agency authorization as other staff register. The provider administrator also maintains a provider setup in the application, and what that is it's a field that identifies whether you have a board contract, and that allows us to interface information with the board. And that person would also run performance reports, and I'll talk a little more about reports as we go on. You need to decide how the organization will manage data flow. Maybe you're already doing this with the OHBH. But if you haven't been reporting before, you need to think about how the data will be managed and how it will flow. It can be compiled manually using paper forms, which we provide outlines for, or it can be extracted from the agency's information system. Ohio MHAS staff are available to help with implementation planning, so we can talk you through, what you need to think about and how to go through this. Plus, we have some implementation tips available on our website in our documentation that will help you sort of think this through. Next screen. So we have basically two groups. Implementation group 1 are providers currently reporting in the legacy system, or the OHBH. And that's defined as any provider that has reported in the OHBH since July 1, 2018. At any time, you can, like today, tomorrow, or not, yeah, tomorrow or next week, anytime, you can request access to OBUS test environment for piloting files and records. But you have to request access. It's not automatic. You can register for OBUS access on the website. You don't get that access until we open up the production site. In the interim, before we open up the production site, you can send us an email and request access to the test environment for piloting files and records. And the field will be notified well in advance of the legacy system being taken offline. So for this first group, if you're currently reporting, you're going to be notified well in advance that on a certain date, you no longer enter records into OHBH, and the OBUS system is open and ready to receive records, and we migrate all the records over. So we close down one system and open up the other. That's and you will be told well in advance of that. Next screen. Then there's implementation group 2, and that's providers that are not currently reporting. And that's defined as any provider that has not reported in the OHBH since July 1, 2018. So maybe you reported in 2016 and haven't done it since then. You would be considered again in this second group because you're not going to have any records migrated over. That's one of the big things that defines the group 1, is there's a record migration. You can also request access to OBUS test environment for piloting files and records at any time. And there is currently no deadline for when providers in Group 2 must begin reporting. So as like Group 1, because we migrate records, as soon as we migrate the records, that's when they begin reporting in, or that they can begin reporting in the OBUS system. With Group 2, since we're not migrating any records, you can come online anytime after we open up the application for data entry, but there is no deadline. It's just, and we expect to work with the field over weeks and months, getting you to come online. Next screen. So there's also a feature called OBUS reports, and this is particularly important for the boards because the data entry application is only for providers to put in client level data, either through flat files or through manual templates. The boards and providers have access to records, to reports, and the reports basically fall into 3 groups. The management of OBUS records, so that's system performance, basically how many admission records are you getting in, how well are your admission records matching up with claims, things like that. The management of the OBUS records. Then there's descriptions of client characteristics, those reports, and client outcomes, which the NOMs. Providers can access reports with client level data. Boards can only access summary reports. There's no client level data available to the boards. Next screen. So here's an example of the record management reports, and probably one of the reports in the past that has been the most useful to be used is the first one, matched claims with admissions summary report. If you've used the OBHIS, you probably might have experienced creating admission records and not seeing how your admission record has to be matched with a claim. But we really can't verify that your admission is a valid admission until we find a claim for that client in our data warehouse. So this sort of shows what the match between admission records and a claim for that client is. It's a performance indicator, and it also gives you some indication of how well are you getting admission records in to go with claims. Now in the past, this performance report, and when everything ran through McSys, it was very automatic. Because we have claims coming in through Medicaid, coming in through shares, extracts from the boards, and other extracts from the boards, we have some lag, and it goes all into a data warehouse. We have some lag time between the claims being matched up with the admissions. So sometimes we'll have admissions without claims yet, or sometimes we'll have claims without admissions. So we don't exactly expect to see a real high. We're going to have to work with this report as we go forward to see how the matching of the claim with the admission record, how that works. So that, but it is a useful performance measure. Other record management reports is missing admissions. It gives you a detailed report on if you have claims but there's no admission, and you can see the names of the people we have claims on that we don't have admissions for, and so on and so forth. We go into more detail on how to use those. We'll be doing some trainings on how to use the reports. Next screen. The client status reports are based on either an admission record, an update record, or a discharge record, and it's cross-sectional. So for example, the second report, employment status summary report. If you choose admission records, you can look at within a certain time frame, what is the employment status of the clients you admitted within that time frame. Or if you choose discharge records, you can look at what is the employment status of those clients within that time period. Now, the example I've given you here is living arrangement, and you can see that in the top report, it's got the categories of housing, and you see that there's 131 records overall within the time frame chosen, and of that, 23 were homeless, and so 18% of the clients on these, this is an admission record report. So for admission records between a certain date range, 18% were homeless. Now what we're giving you at the same time are statewide summaries. So you can look and see where your agency is in terms of the whole statewide. And if you look down on the statewide, you see that for the same time frame, 8% of clients admitted were homeless. So you have some way of assessing where your data falls in the total picture, statewide data. And there are statewide reports available for each one of these. And these are basically the NOMs. There are some additional information like tobacco use summary report. So how many clients are smoking at admission, what percentage of your clients, and then statewide, what percentage of clients smoke. That's what you'd be getting. All right, next screen. And then there's outcomes and performance reports. So these are longitudinal. This is looking, you have to have a time one, like an admission, and you have to have a time two, an update or a discharge. And we're looking at the change between time one and time two. And what we're reporting out the percent that fall in that change category. So I chose disposition at discharge, and we, if you know the records that we currently have, there's about 12 or 15, 16 discharge reasons. We summarize those up into successful, unsuccessful, and neutral. And we have a guideline to how those get summarized in our documentation. But you can sort of see at a glance that 22% of the clients within the time range you've selected had a successful discharge. How does that compare to statewide? Well, it's a little better than 19% statewide having successful discharges. And that's really longitudinal changes, true outcome measure. Okay, let's see the next screen. So we keep everything. We have a website, a web page, and it's listed here at the top. And you go to our web page and you look at the banner for the department. If you look under behavioral health professionals, I think it's the second item down, is data reporting. And if you go to the OBUS web page, you have training videos, technical specifications, implementation guidelines and updates, user guides, registration login links, and much more. I wanted to draw your attention to the related topics. So the first link is just linking to the OBIS web portal, and the web portal is iPortal. That's what it is. If you've already registered and you click on that link and you log into iPortal, you probably will see the icon for OBIS, but you aren't going to be able to open it until we go live on that. The second link is a registration for OBIS access. And again, I can't stress enough, you have one staff at the agency who registers and is designated as a provider administrator. Once that person is approved by us and is registered approval, then anybody else at the agency who goes in to register will be approved by that provider administrator. It'll come, the email for request for approval will come back, because it's kind of difficult for us to know who at an agency is really with that agency. So we're putting the approval process in the hands of the agency to the extent we can after we've approved the provider administrator. We have two videos, introduction to OBIS batch upload and user interface. So that's actually a video of a PowerPoint. It goes into a lot of detail, a lot more than I've gone into today. You can look at those now if you want. Also, Intro to OBIS manual data entry with user interface. So that is quite detailed. I just showed you a screenshot of the data entry template, but this actually shows you in great detail how to enter a record and how you enter different types of records. And of course, there's a link to the Ohio MHAS help desk. Next screen. So then I also wanted, so you kind of appreciate how much is on the page. On the left-hand side of this screen, there's several folders at the bottom of the web page. Somebody needs to mute their speaker. Okay, so there's several folders at the bottom of the web page, and you have to scroll down to see it. And the first folder is called Records, and that's basically OBIS records field definitions. I can't stress enough, especially if you've not reported MH before, you really need to look at the field definitions, and we will be doing some trainings on that. MH has some very specific housing definitions that SUD does not or has not used. So there are some, it is important to understand your field definitions, how we're defining the fields. You have if you have a housing set of options, how you choose housing, residential, group home, that sort of thing. It's really important that you understand what the definition of that choice is. You also get the implementation tips for agencies new to reporting or those transitioning. Client record fields. We have also the paper forms, admission record fields, discharge record fields. So those are the paper forms you can use if you're going to collect data that way. We have batch upload technical specs, XML files and SLXS files. We also have the schema definition, user guides, and business rules. So we post everything there. You should, when you look at implementing, that's your go-to source. Although, send us an email. We'll always work with you around finding things if you can't find it in the documentation. So that is it. I think I'm ready to field some questions now. I don't see any. Oh, see, I see a hand. Okay, so I'm going to click on Jakiba. Lower hand. Question, Jakiba. Did I say your name right?
Yes, can you hear me?
Yes.
Hi, Carol. This is Jakiba from Recovery Resources in Cleveland. And I have two questions.
Mm-hmm.
The first one is the field for the Medicaid number.
Oh,
if we receive that is pending by the Adams board, if I receive a form that says pending, so I don't have a number, my first question is how important is to go ahead and submit it without the Medicaid number? And then the second question is, I've received several of these where the ICD-10 codes do not actually match what's in OBUS, and how important is
in OBUS or OHBH?
In the OHBH,
okay,
when you're submitting the form,
yeah, okay,
for the codes, how important is it for the terminology? Because you just mentioned that the records and the field definitions, how important is it to have to match it directly to what's on the form to what's in the portal?
Okay, I'll take your first question, then your second. So the first question is, it's really important that you put in a funding source ID number, whether it's a board ID number or a Medicaid ID number. You can put either one in. We don't, you don't have to wait to get a board ID if you have the Medicaid ID. Just go ahead and put the Medicaid ID in.
But if we don't have
if you don't have either, basically what happens is you create an admission record that we can't validate or can't verify. And part of the information, part of the system, you can go, one of the reports that we have available, and also it's available on the template, you can see unvalidated records. So you can see the records where there is no match between the admission and a claim. Now that there's a lot of reasons why there might not be a match between an admission and a claim, but one of the big reasons is because you weren't able to enter a payment source ID code. Until you do that, we cannot make a match, and therefore the record doesn't go into our system, because we have to have that payment information in order to validate the record and put it into the data warehouse. It just sort of sits there indefinitely until we get that information. So does that help? Does that answer that question? You have a choice. You have a choice.
Not answered.
It depends on how, one choice you have to do is you can either hold off until you get the payment ID information and then enter the record, or you can enter the record and then go back and enter the payment ID information. So it just depends on how you want to manage that. Now, the diagnostic code, that's been a problem with the OHBH, and we have updated the diagnostic codes for OBUS. So, however, they're constantly expanding and changing. I mean, I would assume that when you get into OBUS, you should see a diagnostic code for whatever the diagnosis is. If you don't see a code for what the diagnosis is, I think you should probably inform us of that. There's always the option, I have to look, you have to kind of look at the documentation, but there is always an option of sort of kind of unknown diagnosis, you do have that option. So
Well,
it's like
for example, the code could be moderate alcohol and early remission.
yeah,
And there isn't anything that says that in the portal. It may
right.
be just the base and the ICD-10 number. The codes
Right.
would be not matching what you have in the portal.
Yeah, that's a problem with the OHBH. I think we've taken care of that with the OBUS system. Of course, we don't really know until, I mean, we've checked it, we've looked at it, but we won't really know until we go live and start trying to collect the data whether we've taken care of that problem. But we would want to know about that if that's a problem, because that is something we've tried to address with the upgrade of the system.
Okay, I can contact you offline then.
Yeah.
Thank you.
All right. And now I'm going to talk to Tatal. Gosh, I can't get the hand symbol to. Oh, I see what I do. Okay. Is it Tatal? Hello? Do I have Tatal on the?
Talib?
It's just Tatal. So.
Yeah, somehow it just got misspelled.
Okay.
I want to thank you for the presentation. It gives us it gives me a lot more insight than it did last September as we tried to get ready to know that there's a test site. So all the documentation, the schema is still the same in the website, because we have our vendor kind of like on hold to reproduce the screens because the fields are different. They don't match in the old OBH system and the OBIS system. So we're concerned about that part. And when do you have any idea of a go live date? Because we want to make sure, because they have to recreate all of this for us. And then you do have a test site, so that helps us.
So are you going to a batch system? Is that what you're talking about?
Yeah, we've been using files? Yeah, we've been using a batch file for probably the last 10 years. We started out when you were doing it. It was a flat file. And somewhere a few years ago, it changed from a flat file to an XML file, which is where it is now. And I understand it's a flat file now. I'm just kind of concerned about the timeline for us.
Well, I would say that it's been my experience in working with providers that it takes a good 3 months to get a batch system running and operational. So give yourself that much time. I don't know when we're going to do the migration of the data. I would hope that it would be August or September, but it's really a call for the director to make. And we will be working with the field. Now, if we go live before you're ready to upload files, that's okay. You're not going to be penalized for that. In other words, but I would say start working on it now, because it will take you a good 3 months.
Right. Well, we've begun the process. We just didn't know where we were.
Okay.
Since the last time we actually received any communication was probably October. So,
okay.
But thank you, and we appreciate
okay.
all this information.
Okay. Eva.
Yes, hi, how are you?
Just fine.
Good. I have a couple questions. So my first question would be regarding the release of information, because I didn't even know this was a requirement. And so for the clients that have been discharged, what would be your recommendation? To not enter them in the system? If that
they've been discharged. You wouldn't enter them in. Now, you might have clients that have open admissions, and those open admissions transfer over to OBUS from OHBH. I would assume we're just transferring it. So it's basically starting from the day forward with new admissions. When you start using OBUS, starting from that day forward, you need to be working with informing them and getting a release to create new admission records.
Okay. And, we just started our treatment services and just got our certification from OBHIS last year, but we actually didn't start serving clients until like November. So I was totally unaware of the system for us to put information in. So we're going to, and I do see that you that were approved, and I have all the stuff set up, and I'm going to be the administrator of it. So just moving forward, I'm going to start with new admissions, just so I'm clear.
That's one way to do it. I mean,
Okay.
this is not all we have. That's why any questions you have and you want to work around implementation, you know, just send us an email and we'll advise you about the best solution for you given your situation. This is not, there's not like a one approach fits all in terms of getting you up and reporting.
Okay. 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 Thank you.
Okay, I don't see any other hands up, so I might be, let me look, yes, there's a hand up. Okay. Angela. Angela Steele. There's a couple of Angelas. Angela Steele Thompson. You had your hand up. Okay. Gosh, more. Let's see.
Okay.
We're
Carol?
looking for, yeah.
Yeah. Nick sent you an email with all of the written questions so that you can just go through there a lot easier.
I saw an email pop up in my window, but I don't see it. Wait a minute. I can't. Here we go. All right. Here we go. Carol. Okay, so here are the questions that were asked in the chat box. Will the slides be made available to attendees? Yes, they will be made available. And I think also with the question, the question and answer, that will be part of it too. And the voiceover explaining the slides, talking through the slides. Yes, that will be on, I guess that will be put on the website one day next week. The question, is this an optional system? It's required by Ohio Revised Code. So it's not optional. It's a requirement of being certified to provide behavioral health services with public dollars that come through Medicaid or the board or the Department of Mental Health. Is there a paper version of all the questions available? Yes, that is the paper form that I showed you under the documentation that shows what all the questions are of the data we're collecting and what all the response categories are. What kinds of reports will be available to the agencies and to the boards? Well, I went over that, but we're going to go into more. We're going to have other webinars where we go into the reports, go into a lot more detail about how they work and how you use them. So there will be trainings available on the reports, but I sort of covered, generally speaking, at a 20,000 foot look what the reports do. Okay, are the flat file uploads still going to be in an XML format? Yes, they can be in XML or XLSX. You have some choices. You need to work with your IT or your vendor about what the best choice is for you. And of course, you can work with our IT around getting that to work with pilot testing at the test site. Do you have a data set which will be infrequently changed? I hope so. We understand. We understand that once this gets set in your system, it's very hard to change things. So yes, we're not planning to change anything that's in this data set anytime soon. Now, 3-5 years down the road, you know, the SAMHSA might be asking for some things that we're not collecting, but we're not planning to add anything. The state's not planning to add anything just from the state. There's always a chance that SAMHSA will ask for something. But again, that's not anything current, and we are doing everything we can just to keep this as it's locked in. That's what it is. And if the ADAM board pays for services at a correctional facility, should those be included in OBIS? Actually, yes. Now that, yes, if ADAM board is paying for those, now you have to look at, that's where you have to kind of look at some of the definitions of the fields. For example, if it's a mental health admission, there's actually a locus of care field where you would say it's a jail. If it's an SUD admission, you don't use the locus of care field. That only applies to mental health. And you would just say location, you would just say housing would be jail or prison. So that's where really looking at the, especially around housing and location of care, looking at those definitions closely you should take a good look at that so you understand. But yes, if the Adam board pays for it, you need to be reporting it. And we can help you determine the best way to report it in terms of what field selections you need to be using. So that's that. Now let me go back to, I don't know if there's any, okay. Oh, there's actually more questions. Okay. What if a client has provided both MH and AOD? When you can create a dual record, so you have to create it. This is the SAMHSA requirement. So we know there's really in real life only one admission, but SAMHSA thinks of it as an MH admission and an AOD admission. So you need to create an MH admission and an AOD admission. However, a lot of the fields are shared by both the MH and the AOD record, so you don't have to enter the fields twice. For example, housing status or employment status or things like that. You enter it one time, it goes on the MH admission record, goes on the AOD admission record. So we've tried to streamline that as best as we can, but again, SAMHSA basically requires an admission for each type of treatment approach. Let's see. Do you have a fillable PDF version of the form? A fillable PDF version of the form does the batch reporting. No, I don't have a fillable PDF version of the form. But there is a XMLSX, or basically an Excel file, where you can select values in the file. You can take a look at that on our website under the XMLSX folder and just take a look at what that is. That's not exactly a fillable PDF version, but that does sort of approximate that.
Carol, I could probably make one if there's a need for it in the field.
Yeah.
We would need to know what the need is. So
yeah, how you plan to use it. I mean, I was thinking if you have it as part of your EHR, it just would depend on, because you still have to get it from the PDF into the OBUS system. You still have to upload it somehow. And you can't upload a PDF. You can only upload a flat file. You can manually enter it, but you can't take a PDF with values in it and upload that. The system won't allow that. Does batch reporting require building the OBUS questionnaires into the EHR? That's one way to do it. Batch reporting, you could do it that way. Other ways it's done is you've already got the values in the EHR and you just identify them in the EHR and pull it off into the file. So yeah, you can either build a form in your EHR, or you've already got the data in your EHR and you just go to that field and pull it off. So, okay. Should clients paid for with DRC funding be put into the system? No. No. This is only dollars that are allocated, public dollars allocated for behavioral health treatment. Even though DRC pays for behavioral health treatment, we're not part of that system. And so we wouldn't, if it's DRC funding, we wouldn't take reporting on those clients. The paper form is on the website. It's in the folder at the bottom of the page on the website. They're called, it's just called admission fields, admission record fields. And that's where you see where it says transfer record fields or discharge record fields. That's the paper forms. Because again, this is based on a record system, an admission record, an update record for mental health, or a discharge record for mental health or SUD. Okay. A fillable PDF would be an additional tool for manual entry, but perhaps looking into batch reporting is better. Again, the issue would be we don't have the system built to take a PDF file and upload that PDF into our system and extract the data out and put it in the data warehouse. So that's some technology. I think we could talk about that in terms of phase 2 of the project with IT, how that might be done. But at this point, you can't really go from a PDF and then enter the data that way. Okay, if the Adams Board pays for this is required, that applies only to public monies. Yes. It would not apply to a foundation money that is passed through, but true. If it's private or a not-for-profit or foundation funds, although again, you might want to, this gets dicey. You might want to talk to your board, because your board might want to see, I'm thinking about it. Basically, when you set up the client record, I don't think we have the option of entering a payment source other than the board, and then the only thing we would use is a board ID number. So if your board wants you to report it using the board ID number system for their payment system, you might try that if that's what the board wants you to do. But you typically couldn't just take, like, let's say you're getting from United Way and the board is passing United Way funds. We don't have the option of saying this is a United Way funding source and this is the United Way ID number. That you can't, you can only identify it as board funding source and board ID system. For SOR clients, do we enter GIPRA? Oh gosh. I think so. Yes, I think the answer is yes. Again, can you make a note of that, Beth, for the SOR clients, do we enter GIPRA and also OBUS? I think you do, but again, I think we need to probably talk that through with the SOR grant people to be sure that we're not asking you to duplicate things. So I don't have an immediate firm answer to that. But I sort of think you probably do. I'm not sure what you're reporting with the GIPRA. You may be reporting a lot of the same data with the GIPRA. So then it becomes very duplicative. We'd have to take a look at that. Okay. I understand you don't have a go live date, but do you have a ballpark timeline? 3 months, 6 months? I would say 3 months is a ballpark timeline. Certainly 6 months is, I mean, I wouldn't think it would be as long as 6 months. So I would say 3 months is a ballpark. Is there a standardized state release form that agencies can use? No, there isn't. You basically have to build the release into whatever intake forms you're currently using. But we don't have a standardized form for that. Do you recommend language for including OBUS reporting to client consents or standard OBUS consent? We can look at trying to get, since this is basically the same question, we could look at talking to our legal office about maybe some standardized language that we could offer you to include in your client consents and client intake forms. Make a note of that, Beth, that maybe we could offer you some language that would be helpful. I mean, we're trying to make this, give you as much support as we possibly can. So I don't know why we couldn't do that, but then I'm not legal. So, okay. The last thing I see in the website is a tab called schema definition. No, it does not. The schema definition is what's used with the batch upload. The paper form is in the first folder, and you'll see files, PDF files that'll say admission fields or discharge fields, discharge records fields or admission records fields. Those are where the paper forms are, in that first folder at the bottom of the page. Okay. I created an account as administrator and now I can't get in. Oh, well, because we haven't opened up access to the operational site yet. Until we go live, and we will announce that well in advance, you can't get in. And if you want to try to play around with this, then you're going to have to request a test access to the test site. And that's an email to IT asking for access to the test site. So we could set you up there if that's what you want to do. Okay. Okay, got it. Thanks. Okay. Is problem gambling? Yes. Problem gambling is captured on the discharge form. And the question that's being asked is, was the client screened for gambling? And it's a yes, no, don't know. Yes, the email contact would be Craig Knudsen at mha.ohio.gov. Yes. Did I get everybody's question? I hope I didn't overlook. Okay, is a test site access from the last time still good? I'm not sure what you mean by last time. We've had the test site available for about a year or better. So if you've had access to the OBUS test site within the last year, yes, it's still good. You still can access it. Okay, do I have any other questions? Participants, okay. I think some people are leaving too now. So I don't see any more questions. And does anybody see that I might have skipped anything?
There's a hand raised, Carla Wilson.
Okay, I have to go to the hands. Okay.
Sorry, thank you. I don't have, for some reason, I don't have a chat function. It's not showing up on my screen.
Okay.
So I couldn't ask the question. And I know that you covered this on here already, but I didn't hear very clearly. If the client does not have a Medicaid number, is that the only number that they need for this, or would they put their GOSH number in?
GOSH number, your GOSH number.
I just wanted to make sure I clarified because I didn't hear the full answer. Thank you.
Yes. Okay, I'm trying to get Scott to, I'm not getting back. Basically, I'm not able to go back to, let's see this. I'm not able to. Rob, can you get the hands? I can't get, I've lost contact with the hands. Wait a minute.
I'll take myself off mute. I don't see any more hands raised at the moment.
Okay.
Oh, I take that back. Scott as a guest.
I tried to click on Scott, and I'm trying to click on it, and I'm not getting any response. I mean, it's not opening.
Can he unmute himself so that he can talk?
Yeah. Scott?
Can you hear me?
Yeah.
Was problem gambling captured in OHBH? Were there any outcomes there?
No, it was not captured in the OHBH.
So this is going to be a new place to capture that data?
On the discharge record of, yes.
Okay, thank you.
Do we see any other hands? Anybody?
I don't.
Okay.
I see that there are 4 hands up, so somebody's got their hands up. I don't know who though.
Oh, Scott, I see Scott. I can't see. I tell you, this technology, it's amazing, and at the same time, it's maddening. Oh, here, Lucille. Yeah, Lucille
yes,
has.
Thank you, Lucille. Thank you.
Yeah. Okay. Lucille. Hello?
I think she might be muted, but she asked a question in the messenger that was like really good question.
Okay.
Okay, so now I'm unmuted. It's Lucia Lowe from Lima Human Doc. Yes, ma'am.
Hi.
And yes, hi, how are you guys doing? Thank you so much for this opportunity and also for the information. I'm going to make sure I stay connected and updated. However, I do the data entry for the OBHB system. And my executive director is the operating administrator for that system. So will she still continue to be once we're getting to the OBHIS system?
You have to choose and register. In other words, it doesn't automatically transfer over from OHBH to OBUS. So if you want to be the administrator, that would work better, then you would be the one that registered to do that. And then you would grant her access if she wants to access the data. She would then register after you, and you would grant her access. That's how it works.
Okay, so and my next question is, I need to be clear. The OBHB system will phase out eventually, is that correct?
Right, and it'll go from one day you're entering an OHBH, the next day you're entering, or the next Monday, like it might end on a Friday, start on a Monday. So one day you're entering an OHBH, that system closes, all the data migrates, and then you start up with OBUS. And so any open admissions, any admission without a discharge transfers over to OBUS, and you would go on from there.
Okay, thank you. That makes it clear. Appreciate you.
Mm-hmm. Okay, we have Nicole. Nicole.
Hi. So my organization currently is only reporting SUD related. Now that we're doing mental health, we're going to have thousands to readmit. So are we allowed?
Oh, go ahead. Go ahead.
Do we have to start at a certain point and go forward, or is it, do we have to go retroactively and report everyone since we've opened as an agency?
Right. That's where working with us around an implementation plan would be helpful.
Okay.
In general, what I would say would be, when you start, I mean, you don't, this is typically how I would advise you, but we'd have to know a little bit more about, but what I advise agencies to do is, when you go active in OBUS, you start with all new, like let's say you go start reporting in OBUS in September. Then all new admissions in September, all new MH admissions in September would get entered. Then you would start to back in, if you have clients that are active in September, but they were admitted prior to September, then you would try to phase in those. So you get to the next month. So whoever is maybe still active in October, maybe they got admitted in July, you would try to enter those. But you want to try to phase them in, and certain number you will discharge before you actually put them in an admission. Does that make sense? Some of the pre-existing MH clients you're going to discharge before you actually have to create an admission record form, if you phase in the implementation of admissions. But again, we can kind of, when we've got some, if you look at the implementation guidelines, it does address that question, how to think it through.
Okay.
Yeah.
Okay, thank you.
I don't see any hands. I don't see any more hands. Do we have any more new messages? Just for clarification, we can register for OBUS, but we're not able to access it until it goes live. Yes, that's correct. To confirm, we will need to retroactively add all active clients, regardless of true admit date. Maybe not all active clients. Again, I think it depends. It's going to depend on the caseload size, what the best solution is. So, for example, if you begin reporting in September and you have admissions from May, you would not necessarily, in your first phase of implementing, also go back and capture all those admitted in May. You might actually discharge them in the month of September. So then why would you create an admit for a client you're discharging in September? I mean, that's like an extra burden. So basically what I'm suggesting is you think through a phased in. So your first group would be all those who you open admissions for new in the month of September. Then you would look at all those records you have open in September and don't expect to close in September, and you would try to get those in. I do understand with MH, we're talking a lot about, there's about 2.5 to 3 MH clients for every SUD client in the system. So it is going to be somewhat of a burden to figure this out and work this in. That's why I would just suggest giving us a call and sort of talking through the approach you want to take and how how you can basically phase in your caseload. Okay, I have a question about the new system. Wait. Is this just inpatient admissions? Wait. Okay. Is this just for inpatient admissions or what outpatient services? These are all outpatient services. Inpatient is hospitalized, and we don't take hospitalized. Now, I realize in the SUD world, you might be calling it inpatient, but really if they're residential treatment, that's really, you're using level of care for the SUD admission there. But you would not create a record for a hospitalized MH client or for a hospitalized SUD client. So technically, really, these are all outpatient services, including we look at residential that way as outpatient. Okay, I have a question about the new
Carol, we'll take our last question.
Okay. Do I go to the website from this webinar to sign up as a system? Yes, you can go to the website and sign up as a system administrator. Okay. When filling out OBHIS, who do we fill out to? OBUS. Again, I guess if we can maybe come up with some guidelines on what that language would look like. You're basically releasing the information to the Ohio Department of Mental Health and Addiction Services. So that's who the release of information is to. So there's that.
This has been a wonderful opportunity. This again is Alicia, and I'm going to give Carol just a last minute to make some reflections. And Carol, you may want to make some announcements. I'm not sure.
Oh yeah, those of you who've been working with me a lot. This is my last day with, not quite my last day. Tomorrow's my last day with Ohio Department of Mental Health and Addiction Services. I'm retiring after 25 years at the department. So
congratulations.
And this actually represents work I've done since 2001. I have advocated for mental health to collect this data since 2001, back in the days of the old outcome system. But I've been working on building OBUS since 2015. So I'm glad I got to at least have one final interface with the field before moving on. And
they just put you on the screen. Congratulations, that's wonderful. Good luck.
But by the way, as I've gone along, I've insisted on everything getting documented, and then we've also got other staff trained. So, there might be a few balls that get dropped, but I think they'll be able to pick it up and run pretty quickly.
Yes.
Well, there's
so
Craig.
If you have other questions, we can call in and ask.
Right. You start with Craig. He's your main source. Then he'll figure out if he can answer or he needs to refer it on to another staff.
Okay.
If anyone has any other congratulations for Carol, we'll hold this line open for you because she has been such an integral part of our department. We are sad to see her go, but happy for the next phase of her life. And so, Carol, to you, I thank you for your service to the state of Ohio, and we have just been enormously blessed to have you.
Thank you.
Is everyone else muted, Beth, or can anybody speak up? And
I think you can unmute yourselves if you'd like to say something, and then I'll be on training staff, so we will definitely follow up with more questions and answers and frequently asked things as this progresses. So.
Congratulations, Carol. Thank you for this opportunity to be able to get the answer straight from you, who started all of this, and well wishes on your new chapter of your new life. However, do we have a contact now?
Yes.
Or an email or something?
For the business office, the main contact is Craig Knudsen. He might not be able to answer all your questions, but he will know who can answer your question.
Hey,
if it's a more technical question, it's really more IT-ish, go to the help desk.
And we can add that to the presentation at the end to make sure that you guys have all the contacts you need on the website.
That would be great.
Thank you.
Wow, we did it.
Yeah, I think it was really, really good. So we've still got 80 some people here. We'll let them talk as they get off if they want.
Carol, you did such a great job.
Thank you. Thank you. This was we actually had quite a few practice sessions. This software is not the easiest.
Yeah. But you did a good job.
Well, I have a team. I want to deflect my team. I had Beth and I had Nick and I had Rob did the training. So
we're each having different things that we do. Like I am the slides. Rob was doing the technical part. Nick was doing all the administrative with the questions. So we had it.
Yeah. Great job. I'm so proud of you, Carol.
Thank you.
Well, I'm going to sign off. You guys have a good evening.
Thanks, Alicia.
See you, Alicia.
Congratulations.